Welcome to the Introduction to Building and Leveraging Social Capital Among Tanf Participants to Improve Employment Outcomes webinar. My name is Jennifer Gilson, and I am from Kaufman & Associates. I will be your moderator today. I'd like to start with explaining a little bit about the webinar interface. You should all see the first slide of the PowerPoint presentation and the Q&A box open on your screen. We will be answering questions at the end of the presentation, but you can enter a question at any time into the Q&A box. If you need technical assistance during the webinar, please enter a question into the Q&A box, and we will ask the question, and we will answer you. Please remember to provide your feedback on this webinar using the survey that will appear in a separate pop-up window when the webinar ends. I will now turn it over to Carol Mizuguchi of OFA.
Good afternoon, and thank you for joining today's webinar, Building and Leveraging Social Capital Among TANF Participants to Improve Employment Outcomes. We are very happy to have a wonderful slate of expert presenters to discuss this important topic with you today. My name is Carol Mizuguchi, and I am a Family Assistant Program Specialist at the Office of Family Assistance, and I will be facilitating today's webinar. This webinar offers us an opportunity to share the latest research, ideas, and practices around the development of social capital among low-income families. Within the traditional model of TANF services, attention has mostly been given to human capital, such as education, technical expertise, and training. However, the importance of social capital is being recognized and utilized in practice to draw upon social connections and relationships to enhance economic well-being among low-income families. Research has demonstrated that social capital provides valuable assets to families as they move out of poverty. So our conversation today will focus on an understanding of these practices and the research. In what ways can TANF agencies work to develop social capital among their participants? What partnerships are most helpful to provide these opportunities for participants? Those are some of the questions that we'll answer and explore. This webinar was designed as a two-part series, and we'll have an announcement later letting you know about the second webinar in the series. Our learning objectives today include providing an introduction to social capital, understanding what social capital is and why it is a valuable asset to TANF families, learning about current research regarding how the private safety net and the public safety net interact as families work to make ends meet, and hearing experiences and lessons learned from a program that develops social capital among low-income families with the intended goal of working towards self-sufficiency and moving out of poverty. We are very fortunate to have two dynamic presenters who will be guiding our conversation today on social capital. And throughout the presentation, you will have an opportunity to ask questions through the chat box in the bottom left corner of your screen. We encourage you to ask questions, and if your question is for a specific presenter or program, please be sure to specify that. If we do not get to everyone's questions, we will provide questions and answers that will appear on the Peer TA website, along with the transcript and audio recordings of today's webinar. During the webinar, there will also be a series of polling questions that will appear on your screen. Please answer each by clicking on the radio button next to your selected response. Doing so will not only help us guide the discussion, but it will also share additional information that may inform your practice. So, to set the context and introduce the concept of social capital, I have a couple of slides here. So what is social capital? Social capital can be defined as resources that people have access to by virtue of their networks. Research shows that people who have more social capital are more likely to be promoted, have greater well-being, and the better connected you are, the better you're going to do. It creates greater mobility. Social capital is an important factor in helping families achieve self-sufficiency. There are three forms of social capital that serve different purposes. There's information, support, and also reinforcement of norms. Tanf agencies or related organizations can help contribute to social capital and counter obstacles to self-sufficiency. A recent study published April 2016 in the journal Housing Studies demonstrated that case managers play a role in promoting economic mobility and providing social capital for poor families. So now we'll hear from our speakers. We will first hear from Dr. Natasha Pilkauskas, Assistant Professor of Public Policy at the Gerald Ford School of Public Policy at the University of Michigan. She has conducted research on the use of both the private and public safety nets by low-income families and will be sharing some of her findings today. Then we will hear from Holly Snowball Morales, Director of Employment and Training at Cook Inlet Tribal Council, and she'll be joined by Andrew Freed, Senior Manager with the Employment and Training Department at Cook Inlet Tribal Council in Anchorage, Alaska. Cook Inlet Tribal Council purposely encourages the development of social capital with their participants, as many are living in Anchorage and disconnected from their native communities. After Holly and Andrew's presentation, we will have a facilitated question and answer session for the audience to ask questions of both speakers. So we'll start first with our first polling question. So the first question is, how familiar are you with the use of social capital among low-income families? I'll have a couple of minutes to answer that. It looks like all right, so thank you for your responses, ladies and gentlemen. And now we'll turn the presentation over to Dr. Pilkauskas. Sorry.
No, great. Thank you, Carol. So today I'm going to be talking about some of my research, as Carol mentioned, that focuses in particular, almost all of my work is really focused on low-income families, thinking about one form of social capital that we can think about, which is called social support, as well as the public safety net, so public government programs that are also targeted to low-income families. So to begin, what I wanted to do was give you a quick definition of what I mean by social support. So we've been talking about sort of social capital more generally, and this is sort of, many forms. Social capital can come in many forms, and one of which we might think of as social support, which in particular is where we think about the support that people receive from friends and family. And so social support can come in many different forms as well. We can think about emotional support, so this is having someone to talk to when you need to. Perceived support, which is what we researchers sort of refer to as the belief that you can get support when needed. So you have somebody to loan you some money if you need it. And a lot of research has really shown that sort of perceived support is linked with lots of beneficial outcomes for families. And then the last type of support, which is what I'm actually going to focus on today, is what we refer to as instrumental or actualized support. So this is the support that people actually receive from friends and family. And in particular, so this can encompass a number of different things. I'm going to focus on three different types of support. It's going to be financial transfers, so actually receiving or giving money, housing, and then childcare. So childcare in the form of coming from sort of friends or family. And there are other forms of support, as I mentioned, but these three are really the big three in terms of the most common that families receive. So you might think to yourself, so why are we interested in social capital? I think more generally we understand, but why social support in particular, or at least this is why I'm interested in this area of research. We know that public programs, government safety nets, definitely help families make ends meet, But we also know that there's sort of a lot of limitations. So in 2014, 21% of children in the U.S. were poor. And even if we use what's called the supplemental poverty measure, which actually takes into account government transfers, we still see that 17% of kids are poor. And so we know that the families are doing something to kind of make ends meet, and one way in which they might be doing that is sort of relying on social support. And there's sort of certainly plenty of research that suggests that families do use social support to make ends meet, and that social support more generally is linked with positive outcomes for mothers and for children. But on the other hand, there's also research that suggests that social support can come with strings attached. So it's not necessarily always a good thing for families. And I think sort of one great kind of example comes from a book by Kathy Ian and Laura Lane, where they sort of talk about a mother, sort of a low-income mother who receives a windfall of money. So I think it's an inheritance she receives. And she discusses how what she would like to do is sort of stash this money away to try and kind of have sort of a rainy day fund. You know, this has certainly been in the news a lot lately. But what she finds is that she ends up actually having to give her money out to all of her friends and family who have much more immediate pressing needs. They face, all sorts of challenges. And so her ability to kind of put that money away, sort of really develop sort of her self-sufficiency for her family is really impeded. And certainly there's a lot of research that kind of suggests that this is the case. And we also know that story kind of highlights just how much, your social support network can kind of both impede or promote your, family's self-sufficiency and their ability to become self-sufficient. So today what I'm going to talk about is it looks like a lot, but it's not. I'll go through it pretty quickly. We're going to really just sort of look at low-income families in general, and we're going to sort of say, okay, how many families do we see that are receiving social support? Is there any evidence to suggest that the social support is economically valuable? Is social support responsive to times of economic crisis, right? So we kind of want it to be in the sense that we might think, if someone loses a job, does the social safety net step in, kind of like a public safety net might? And then the sort of other side of the social safety net, right, is that participation in social support coming at a cost to low-income families in particular? And then the last question is we'll look at the overlap between both public support and social support and sort of see how many families are receiving both. I'm going to do a quick description of the data that I'm going to be talking about because almost all of the studies that I'm going to be referencing today draw on this data set. The data that I'm using is called the Fragile Families and Child Wellbeing Study. It's a longitudinal birth cohort study of about 5,000 children who were born between 1998 and 2000, so just after welfare reform. And these children were born in 20 large U.S. cities. Now, the study was really interested in sort of examining non-marital births. And so what they did is they actually interviewed more mothers who were having children outside of wedlock at a ratio of 3 to 1 marital birth. And what that did was essentially create a very ethnically diverse, low-income sample, which is great for studying issues like what we're talking about today. So the children, the mothers were interviewed right at the time of the birth, and then again when the children were 1 year old, 3, 5, and 9 years old. So what I'm going to show you today are a number of analyses that essentially take these data and kind of pull them together. What we can kind of think of this as showing us is sort of the average level of social support that we see amongst urban low-income families with young children. And to begin, right before I show you what we find, I just kind of wanted to give you a sense of what the sample looks like. So 67% of the mothers in the study are what I would say are low income. So by low income here, I'm defining it as under 200% of poverty, so sort of the poor and the near poor. But even if we just restrict to looking at the percent that are actually poor, so under 100% of poverty, we find that 41% of mothers in the study were poor. The study on the average, 15% of the mothers were receiving Tanf. And then among low-income mothers, so those who are under 200% of poverty, we see that about 28% of the sample was receiving Tanf. Okay, so to the first sort of form of social support, which I'm calling doubling up. So this is essentially what we might think of as housing support. So this is living with additional people. And we could, by additional people, I mean people outside of sort of the nuclear family. So the mother and her children, or maybe the mother and her partner and their children. And so this is sort of any additional adults. Now, the vast majority of these adults are relatives, but people can also be living with non-relatives. And in particular, most people are actually living with grandparents of the child. So in this graph, what I'm doing is showing you the percent, sort of how common doubling up is amongst families. And so the blue bar is actually from some research that Census puts out which showed that in 2010, 20% of all children were living in a doubled-up household. So even sort of in nationally representative samples, we see that the doubling up is a very common, happens very often. In the Parental Family Study, if we look at the low-income families, we see that this is about 28% of families were doubled up. And then we can further restrict in looking in particular at mothers who are receiving TANF. And among TANF recipients, we see that one-third almost are actually doubling up with relatives. So in the year that they're receiving TANF, they're also doubling up. So doubling up is a very common strategy sort of to maybe to be making ends meet. Of course, people double up for many reasons, but very common among TANF recipients in particular. So then, and I should say that doubling up, many people who double up still pay rent. So while we might sort of think of this as a sort of form of free housing, evidence suggests actually that the vast majority of people are still paying rent. It just would be lower than what they might have had to pay were they not doubling up. And the same goes for childcare. So childcare here I'm referring to is receiving childcare from friends or family. And so what we see here is if we look kind of at the sample in general, which is what the blue bars are, or the blue bar, or the first two bars are, sorry, the one that says all, what we see is that on average about 15% of children are being cared for by grandparents or kin in this sort of this urban sample. But if we look in particular among children who are actually in childcare, right, because many children are not receiving childcare because maybe the mother's staying home to be with the child, we see that goes up to about 26%. But what's interesting is that we don't really see that these figures look very different if we focus particularly on low-income families or on TANF recipients. They're very similar across all groups. And this suggests that really use of kin for childcare isn't really necessarily something about an economic sort of strategy. While people may choose to use kin for childcare because it may be cheaper, they may have other reasons that they're choosing to use them, right? So they may be using them for preferences or because of sort of the ease or ability to sort of have access to childcare, maybe at odd hours. And then lastly, we can think about private financial transfers. So these are where we're talking about getting money from friends and family or giving money to friends and family. So in this chart, what I'm showing you is the percent in the blue area. This is the percent of mothers or families who gave a private financial transfer in the last month. The red bars are the percent that received a transfer, and then the green bars are the percent that both gave and received transfers. And what you can see from this is that a lot of families are sort of participating in some form of kind of private financial transfer, right? There's some sort of exchange going on. It's nearly 55% of the entire sample. If we focus in particular on low-income and TANF samples, you can see even among the TANF samples it's even higher. And I think what's interesting to note is while the blue bar is sort of the smallest for the TANF recipients, which is this is the 14% gave a private financial transfer, you also have to add in the blue or the green bars, the 19%, right? So here we actually see that that's like 33% of mothers who received TANF in the last year also gave a private financial transfer, but a lot of them, even more than that, right, only nearly 50% received a transfer. So there's a lot of sort of private financial transfers going on. There's a lot of giving and getting. And what this really sort of suggests is that, families are sort of embedded in these networks of people where they have these reciprocal relationships, where this idea is that, you're giving support and you're also receiving support. And that certainly is what the qualitative sociological literature suggests. So sort of turning to the second question is, okay, well, so we see that a lot of people are certainly receiving and giving different types of private support or social support. So, but is this sort of valuable? And we can think about this, and I have some research where what we did was we tried to estimate the rental savings that mothers received by doubling up with others. And this could be both in someone else's home or bringing someone into their own home. What we found is that if you were sort of doubled up for the year, your average savings were about $4,000 a year in terms of rent. Now, of course, there may be other costs and other savings that may be happening as well when you're doubling up, and we're sort of ignoring that. But in terms of your rent, you're likely to save about $4,000 a year. And so that's obviously quite economically valuable. We think about private financial transfers, and here I'm looking at the amount of money that we observe mothers receiving. The average private financial transfer that a mother who receives a transfer is about $1,700 a year. But if we look among TANF recipients, the average is actually quite a bit lower. It's only about $1,000 a year. And among low-income families more generally, it's about $1,200 a year. Now, of course, those are still significant amounts of money, but we can see how, TANF recipients, part of the thing when you're thinking about private financial transfers is that sort of your network that you have access to really influences the amount of money that you're able to get. So, for example, married mothers are much less likely to receive transfers sort of in terms of number, but when they do receive a transfer, they get a much larger transfer. And that's partly because they're much more likely to sort of be part of a higher income network who can give larger transfers. But regardless, these are not insignificant amounts of money. And we can compare these to some of the public safety nets, right? So, for example, if we looked at the earned income tax credit, mothers who receive their EITC in the fragile families, their average receipt is about $2,400 a year. Or we could look at their average amount of TANF that they receive, because mothers actually report how many months of TANF they receive and the average dollar amount that they're receiving. And that average on sort of the yearly basis is close to about $3,000. So a lot of these social supports are sort of comparable to a lot of the public supports or public safety nets. So we might be interested in thinking about, well, we think of the safety net as sort of stepping in when there's some sort of economic crisis or when something goes wrong, right? So we can also think about this in terms of social support. In particular, I think there's been quite a bit of research or interest in understanding whether or not during the Great Recession, whether sort of the social safety net or the social support increased. And so there's been quite a number of studies that have looked at doubling up in particular. And I say that the results or sort of the research suggests that maybe doubling up increased during the Great Recession. Certainly, if you look at the numbers, the raw data, you can see that the percent of people who were doubled up in 2007 as compared to 2010 is higher in 2010 than it was in 2007. And I think there's research that sort of suggests also that at the individual level, when someone they themselves lost a job, they were more likely to go out and actually live with others. But there's also research that suggests that if you kind of look at the aggregate economic indicators, there's not a lot of evidence to suggest that there was all that much of an increase in doubling up really happening during the Great Recession, because if you kind of pull out and look at a longer time span, you can see that there's sort of been general trends, upward trends in terms of doubling up happening kind of anyway, even outside of the recession. And in particular, in some of my own research, we've been finding that there's been really a dramatic increase in the number of three-generation households, so households where there's a grandparent, parent, and child that are living together. But it's been happening kind of even outside of the Great Recession. In terms of the private financial transfers, we do actually, I think the evidence suggests that private financial transfers do increase in sort of times of economic need. Research that looks at both individuals who have lost their jobs are more likely to receive transfers, as well as ones that kind of look at kind of aggregate economic indicators. And then in terms of kin care, there's really been no research that studies this, but maybe in part because we don't expect it to be quite as responsive as maybe private financial transfers are doubling up. So then I said, the problem with social support is, well, we think of this as it's certainly a great resource for families. It may also come at a cost, right? This idea that I help you now, but you're going to help me later, or what we like to call norms of reciprocity, that people may engage in even if it's detrimental to themselves. And so, as I already talked about, qualitative research certainly suggests that the sort of reciprocal nature of social support networks can lead to problems for families. And I have been doing some new research that actually looks specifically at mothers who give a transfer to someone else and to see whether or not they end up having higher levels of material hardship. And by material hardship here, what I'm referring to is sort of, you can think of this maybe as economic instability, but it's essentially inability to pay your bills or having some form of housing insecurity or not maybe having enough food to eat. And so what we're finding is that for mothers who give transfers, they're more likely to experience material hardship. And this isn't necessarily what you would expect, right? You might say, oh, someone won't give money to someone else if it's going to cause them harm, right? But we find that actually the relationship is stronger for lower income families. So the lower you are down the income ladder, the more likely you are to sort of see this relationship. And in particular, that it's giving really small amounts of money that is associated with greater hardship. So for mothers who are giving less than $100, you see they're the most likely to experience hardship. So maybe these mothers who are sort of on the edge that are most likely to kind of experience poorer outcomes, and maybe the population that we're kind of most interested here today. And so then turning to the last sort of part of this research that I wanted to talk about today is to think about the overlap between private support or social support and the public safety net. So here what I'm showing you, just so that we can get a sense of it, is how many people do we see receiving at least one form of private or social support in a given year, right? So on average, in the sample, in the Fragile Family sample, we see that nearly half of mothers are receiving at least one form of private support in any year. But if we look at low-income mothers in particular, so again, that's under the 200% of poverty, we see that it increases to about 58%. And then if we further restrict and look in particular at mothers who received TANF in the last year, we see that it increases to 64%. So a lot of these mothers are receiving at least one form of social support in any year. So then we can take this and we can think about, okay, so this is sort of the average level of private support. How do we see this in terms of overlapping with public safety nets? So just quickly, before I explain what this graph is doing, what are the public safety nets or the public support that I'm looking at here? So in particular, I'm going to look at 8 different public supports. So this is going to be TANF. It's also going to be SSI, or Supplemental Security Income, public housing or Section 8 vouchers, the Earned Income Tax Credit, WIC, or Women, Infants, and Children, Head Start, SNAP, or food stamps, and Medicaid. So essentially, if I see that mothers are receiving any of these 8 programs, we consider them as having received one form, or at least one form of public support. Many receive multiple forms of public support. And then we can think about whether or not they receive just public support, just private support, or both. So the first three bars, the part that says public plus social, these are the people who are receiving both public benefits as well as social support. And what we can see in the blue column is that on average, about 40% of the mothers in the study are receiving both at least one form of public and at least one form of social support. So if we move to the red bar, this is low-income families, and then the green bar is TANF recipients. So 64% of TANF recipients are receiving at least one form of public support and at least one form of social support. And then we can look at the next set of 3 bars, which is public safety nets, right? And here what we see is that kind of on average, about 40% of mothers are receiving just public support. So they're not receiving any private support. And then we can see in terms of the only social support or neither, we see practically no one. Certainly the low income and the TANF recipients aren't falling into either of these 2 categories, right? So this is important because a lot of literature, certainly a lot of people think about in terms of thinking about something called crowding out. So economists like to use this sort of language, thinking about whether or not sort of the existence of public support crowd out the use of social safety nets. And what this suggests is that no one is really relying exclusively on social safety nets here. And what it suggests is that both public support and social support are sort of working together, right? We think of them as complements, and they're probably working together, especially for low-income families, to kind of help them make ends meet. So in sum, my research finds that about half of urban families with young children are receiving at least some form of social support, and in particular those who are low-income or who are on TANF. Social support is economically valuable, and it's on par with many different forms of public support. And social support is somewhat responsive in economic crises, although I think that findings are a little bit mixed on that front. But it definitely comes at a cost to families if they feel obligated to help others at a cost to themselves. And I also think that this sort of shows us that, I don't think we want to think of social support as a way of sort of replacing or kind of taking the place of any sort of public safety net. And certainly I think we find or certainly suggest that people are relying on both public and social support to kind of make ends meet. Social support is not serving as a substitute, but rather more as a complement to public safety net. And that's it. So if you have any more questions, please feel free to email me. Thank you.
Thank you, Natasha, for sharing your research with our audience. So before we move on to the next presentation, please take a minute to answer the next polling question. Oops. Does your program currently offer services that encourage TANF participants to leverage their social capital? It looks like All right. So thank you for your responses. Ladies and gentlemen, I will now turn the presentation over to Holly Snowball Morales and Andrew Freed.
Good morning or good afternoon. Thank you so much for having us today. This is a picture of our building at Cook Inlet Tribal Council. We are a tribal nonprofit service organization assisting Alaska Native and American Indian people of all cultures residing in the Cook Inlet region of South Central Alaska through a variety of impactful and innovative programs and services that empower our people. This picture is a picture of our service area. CITC is located in Anchorage, Alaska. The green section of the map is CITC service area and is called the Siri region, with the northernmost point 140 miles from Anchorage and the southernmost point some 255 miles away. Some communities are completely inaccessible by road. For example, the village of Tyonek on the western boundary of the region lies across the Cook Inlet and can only be reached from Anchorage by bush plains. Also, traveling to the village of Seldovia requires driving south for 4.5 hours and then taking a 10-minute flight over the Kachemak Bay.
Our services, this is what we do. CITC serves more than 10,000 participants annually through 4 core service areas and a breadth of innovative and impactful programming that empowers our people. Our educational services, they provide advocacy, counseling, and tutoring for our youth. Our employment and training services, we house a number of programs designed to improve self-sufficiency and the quality of life. Our child and family services primarily focus on family preservation, and our recovery and reentry services help those currently struggle to overcome barriers to reintegrate into our society. CITC has an annual budget of nearly $43 million. We employ approximately 200 passionate and caring individuals. Our people, this is who we are. From the past, our people have lived almost entirely in small communities that shared a common heritage, language, and way of life. Today, many of our people are part of multicultural and multi-ethnic families who speak English, and we live in cities far from their ancestral homes. Even as our people become more diverse in how they live, where they live, and how they look, they continue to be linked to strong family connections, a sense of shared heritage, and deeply held cultural values. CITC is unique. We serve many people, many cultures. Here's our mission. Our mission is to work in partnership with our people to develop opportunities to fulfill our endless potential. We envision a future in which all our people, especially our youth, the stewards of our future, have access to vast opportunities and have the ability, confidence, and courage to advance and achieve their goals, infused with unshakable belief in our endless potential.
This model shows how CITC views social capital in serving our people. We feel it is important to learn about each participant's social capital so it can assist us when we're working with them to understand how they use their social capital when working towards self-sufficiency. As you can see, the center of the model is our people, and the small circles that surround the participant is their social capital. The first circle is school. This could be a youth advocate, school counselor, teachers, etc. CITC plays a role in this piece by having a youth advocate and teachers in some of our district schools. We have them stationed right in the schools with the school district employees. This allows for students to get wraparound services from the youth advocate, which could be anywhere from helping with bus passes to attending parent-teacher conferences to doing home visits. We also host potlucks and events at the school to help parents become accustomed to the school environment. Some parents are intimidated to go into the school because they come from small villages, which at times have a smaller population than the number of students at the school. By inviting them to come into an informal event, it can become a way for them to connect with the school. This is an important social capital and a great support for parents. The next circle is neighbors. Many of our participants are living in apartments or trailer parks. It is important that they build their social capital within their neighborhoods. It is very common for our participants to rely on their neighbors for transportation and babysitting. It's amazing to hear all the different supports they have right in their own apartment building or neighborhood. The next circle is friends, and again, this is another support that participants can rely on, similar to neighbors, especially for those participants that are not from our city. They rely on friends to fill the void of family that may be lacking in the immediate area. As mentioned previously, many of our participants come from small villages, and they're used to the concept of being raised by a village, which is absolutely the case in Alaska. Family, where we live, family is a huge social capital. It's not uncommon for participants to live with multiple family members. Most of our participants prefer to have family watch their children instead of using a daycare center. The next circle is culture. Alaska Natives have strong ties to their traditional ways of living and providing for their families. Song and dance are a large part of our traditional lifestyles. Villages have large celebrations and invite other villages to have Native dancing, celebrations of successful hunts, and celebrating new life and death. Another important cultural capital is subsistence fishing and hunting. In the village, it's vital to hunt and fish for your family's survival, but equally important is the connection between that person and the traditional way of life. Being in an urban area, it's important for CITC to know the importance of these social capitals and do things to help create new cultural connections in our community. CITC is viewed as a community building, and we have a lot of cultural activities held right here. CITC also does events such as quarterly cultural gatherings and workshops for things such as drum making, cussbook making, which is our traditional clothing, and beading. We also assist families with purchasing subsistence tools such as fishing and hunting gear. We have workshops and outings to teach families how to do subsistence fishing. The next circle would be community, different agencies in our communities that provide services to participants to help them bridge gaps in their basic essential needs. The last circle is CITC. As we have mentioned, talking about all the examples of social capital, the last circle is us, and we feel that we are weaved throughout the different social capitals. We connect them with social capital, and we try to fill a void where we can.
Next, we're going to talk about our Tribal Tanf program and how we have integrated social capital in our service delivery. First, we implemented our program in July 2005. The population we serve. Currently, our Tribal Tanf program serves an average of 500 families per month. We serve Alaska Native and American Indians residing in Anchorage and the Mat-Su Valley area, regardless of which tribe they're enrolled. Here, Alaska Native and American Indian participants must receive their Tribal Tanf cash assistance from CITC. They don't have a choice to receive their services from the state. Our service model. At CITC, all participants go through a common intake to ensure they are applying for the correct services and identify additional services they may be eligible for. For most agencies are asking the correct questions about how to elicit information from participants in order to determine what their social capital is for them. But it's recognizing what those supports are that can contribute to their long-term self-sufficiency. That is what our case managers are being trained or have been trained to do. We are implementing constructs from the Bridges Out of Poverty to help them understand better what social capital is and how it can be used. And now that our staff have been trained in the Bridges construct, we are in the process of implementing workshops and teaching our participants as well. This is vitally important because when the participants no longer need CITC as a part of their social network, they'll still be able to sustain self-sufficiency within their sustained social capital. CITC has developed youth employment services to enhance the social capital of our youth on our program. By providing job training and job opportunities, our youth gain experience and work with different people in the community who provide vital feedback needed to develop their mental and emotional maturity. As mentioned earlier, with having youth advocates in the schools, our youth case managers work in partnership with them to ensure our Tribal Tanf youth have the support in the school. Additionally, our tribal Tanf program requires our parents to attend parent-teacher conferences and regular school attendance. Our youth program also hosts a number of prevention events to help create relationships among the tribal Tanf youth. These relationships provide support to help overcome common barriers and create lasting success.
Okay. CITC is intentional about making social connections. We use, the first bullet here is a cohort model. We use the cohort model in our training and workshops. We found that the model naturally creates connections and support among our students. For example, we have social gatherings in the form of potlucks before some of the trainings begin to help the relationships and introduce students to each other. During this process, if we are aware of certain challenges that students have in common, we would facilitate helping relationships. Connected to the cohort style is their long-term self-sufficiency. For example, we had 2 students attending one of our ironworkers trainings. One student didn't have transportation, and another student who lived in the same neighborhood had a vehicle. We offered the student with the transportation extra gas vouchers if he provided the other student a ride. The result was a long-term relationship in which they helped each other complete the training. The next one is teaching participants what it is. Andrew mentioned that we're going to be starting workshops in the Tribal Tanf program for participants to learn about the bridges out of poverty. And that will teach them social capital and how they can use it to be self-supporting. For youth services, one of the examples of where we're expanding social capital is with our after-school programs. We currently have an after-school program called Schoolyard that was very successful with teaching students to build relationships with other students, CITC, and their schools. This was so successful that we have replicated this on-site at another local middle school.
Now you've seen some of the successes we have. I want to talk about a couple of the challenges. But before I do, I want to bring attention to that picture of the young lady that was part of our Native Youth Olympic program here we have every year at CITC. She's actually involved in the Eskimo pool, which is a contest of sheer strength and determination. Traditionally, that has been used to practice pulling seals from the ice, and I just thought that picture was outstanding. But anyway, some of the ills that we have to deal with here at CITC, and I'm sure most other programs as well, disproportionate social ills. 20% of our Alaskan children are Native, but they make up 60% of the total children in foster care. Alaskan Natives and American Indians have a need for substance abuse treatment that is almost double than any other race or ethnicity. Alaskan Native men make up over 37% of the total incarcerated population of men, but they only make up 8% of the total population. Alaskan Native men between the ages of 15 and 24 have the highest rate of suicide among any demographic in the country, with an average of 141 suicides per 100,000 each year between the year 2000 and 2009. The reason this has become a challenge for our participants is due to the bridges that they burn and the social capital that they lose when they are struggling with some of these issues. Social capital abuse and unreliability. Some participants that we are working with are unwilling to remove some people or things in their life that were social capital and have now become misused or overused. There are times when we are working with families and they have family members that come to stay with them and they stay way past their welcome. This is especially challenging when there is substance abuse added on top of it. Another challenge is when family members who are watching their children have become unreliable. Participants are sometimes unwilling or untrusting of daycare centers, so they continue to use their family or friends. Now, it can be very discouraging because there are great child care centers here in Anchorage, but we need to continue to work with families to see the benefit of quality, licensed care. Now, some of the cultural perceptions have challenges as well. As most of you are aware and probably deal with the same perception, but our families sometimes prefer to live with several families in one housing unit. Other programs or agencies view this as crowding or homelessness, but many of our friends would have it no other way.
So today, all of our programs are oriented around the 4 major areas in which we want to affect population-level impact. So the first one is increased self-esteem and cultural identity. We want to ensure that CITC's programs and advocacy help bring about a community in which strong self-esteem and pride in Alaska Native identity and heritage is widespread. Increased self-sufficiency with a reduced reliance on entitlements from the government. We want to create a community in which individuals take responsibility for both themselves and each other.
Third, increase health and stable families. We want to build a community of families that help and strengthen each other. Fourth, increase equity and social justice. Knowing that some of the challenges that the Alaska Native community face are rooted in attitudes and systems that perpetuate racism and prejudice, we want to ensure that CITC's programs and advocacy actively challenge and reform attitudes and systems that hold Alaska Native people back. So this brings us to the end of our presentation. We thank you so much, and in our tongue we like to say, Quiana.
Thank you, Carol. You want to turn it over to go over the questions and answers and how to submit questions?
Yes, sorry, my computer just went blank. So thank you for the presentation. Can you guys hear me?
Yes, I can.
Oh, sorry. Okay, thank you for that presentation, Holly and Andrew. And so now we're going to have our final polling question, and it's already on the screen, and you guys are responding. Thank you. And in case some people can't see, the question is, does your TANF program encourage participants to support and communicate with one another through opportunities such as mentoring, job clubs, support groups, group cohort training, etc.? Okay, thanks for your responses. So just once again would like to say thank you to the presenters. You provided a wealth of important information that we can all use as we work with TANF families. We are now going to open up the session for questions. So we ask that you please submit your questions using the chat box feature. And if you have a question for a specific presenter, please state so in your submission.
Hi, Carol. We do have a question. Does race, sex, class, etc. discriminate federal social capital?
Oh, okay. So I don't know if Andrew or Holly, if you guys would like to address that question.
We couldn't hear very well. If the question could please be repeated.
Sure. Does race, sex, class, etc. discriminate federal social capital?
Did you guys hear the question?
Maybe if we could get them to expound a little bit on what the question is. I'm trying to get my head. Discriminate against federal social capital?
Yeah. Can we, I wonder if the participant can kind of provide some clarification, and then in the meantime, while we're waiting for that, I have a question. There's another question. Just, and anybody on the panel can answer this. What advice do each of you have for Tanf programs interested in developing social capital among program participants? And I know you guys shared some information, but if you could think about the Tanf population, maybe Natasha.
That's a challenging question. You know, I don't work with you know, on the ground, so I think maybe Holly and Andrew might be better positioned to answer that.
Yeah.
Hi, this is Holly. I think, you know, when we looked at social capital and how we could integrate it within our program, that was the reason why we had Andrew. He's actually our Train the Trainer for Bridges Out of Poverty. It was really important to start with the people who are working with our participants and training them on what social capital is and how we can enhance that within our service delivery and teaching participants how to do it. I think that was a really good first step for us, to be able to have somebody in-house that can train our staff. And now that we have him trained, we're getting our life skills instructor trained in the same curriculum, and he's going to be expanding it to providing that same training to participants. It was such an enlightening training, and it's helped us to figure out how we can expand that within our program.
Also, if I could add, one of the things that came out of that was the questions that the case managers asked was specifically to try to identify what their social capital was and to show them how they can be used. And another thing that Holly mentioned a little bit earlier in her presentation was we intentionally gather our people together before we have different trainings or different programs so they can get to know each other. And if we already know that there's some challenges or barriers and it seems to be a good fit, we would kind of like we'll try to pair them up so they can be develop their own relationships to help them go through the different trainings. That's been really successful and something that we're really pushing to do here as we move forward.
And just to kind of expand on that, I think that is one of our most important models is that cohort style. I just recently went to some of our students went through an occupational endorsement training, and at the end, when they were all standing up and talking about how they wanted to thank people involved, almost every single one of them thanked their fellow students for supporting them, and that really showed how successful it is for them to make it through the training is by having that support from other students who are possibly in the same situation that they're in and struggling with some of the same challenges.
Great. So, more questions from the audience?
So we have another question. How do you protect client confidentiality while encouraging cohorts, peer supports, etc.?
Well, one of the things, when we don't actually put any information out there that would actually go against or violate any confidentiality or anything like that, and we try to make it more of an organic conversation when they have these different challenges and they're willing to share with their peers. I know with one of the moves we're actually doing now with changing our case management model to move more toward a job coaching model, and they were actually, instead of just having individuals in the, they meet one-on-one with the case manager, we're moving to more of a cohort for those that are work-ready, a cohort where they will be together for maybe 6 to 8 weeks, and during that time, they will have different resume classes or different trainings, And organically out of those trainings, they would come up and they would be able to help each other overcome the different barriers that they have in common or that they've overcome in the past. And so that way their challenges comes out organically. We don't actually have anyone stand up or tell what their challenges were, or we don't have any way of just telling everybody what's going on with everyone else in there, but it's more of a self-disclosure that they would have as they develop those relationships.
And on top of that, it's a matter of talking to the participant that is having that particular barrier and saying, asking them, would it be okay if we see if anybody who lives in your neighborhood or anybody else who has transportation to see if they'd be willing to carpool. And a lot of them are completely open to that idea.
Great.
So we have another question. In larger cities, the population is highly transient, moving month to month. Has any work been done to see how they form supports?
I have some thoughts about this. I think certainly you're right in noting that people certainly move a lot very frequently, especially, people who are, very low income, and that some of the research certainly suggests that some of the reason why we see people moving so much is that I think actually some of what was touched upon in the other presentation by Andrew was that, people also kind of in some ways use up their social capital, right? So you're spending a lot of time, if you're living in, with family or friends, there's only a certain amount of time that they kind of want to have kind of extra people in the household. And I know it certainly can be challenging, and so in some ways I think some of the, certainly people in terms of research think of this as kind of using up your social capital. But I don't know of any research in particular that's actually looked at whether or not, how people are forming support if they're moving frequently.
That's a good question. We'll have to add it to our website and also just explore and see if people have information on that. So transient. Any more questions?
So we have a clarification for the one earlier. Does race, sex, class, etc., discriminate the state distribution of federal social capital?
State distribution. Well, so this is Carol, and I don't think that states actually distribute social capital, because social capital is more at program levels, and I would hope, and this is me just taking a stab at this, and the panelists, you guys feel free to join in, is just thinking about social capital as these networks. So social capital isn't necessarily a service, it's more of an approach, and we're asking and hoping that states will try and incorporate social capital models into the services that they're providing. So, for instance, an example, again, of social capital would be a person's network. So I'm not really sure how states or what discrimination would look like in helping programs or participants develop a network. So I guess the short answer would be no, but I don't know. There's always opportunities, I think when unconsciously and consciously, and hopefully it happens unintentionally, there, discrimination does come into play in some of the programs. But I think with social networks and with social capital, we're really trying to get families to, or participants to develop and leverage the relationships that they have. So it's more about relationships. And a program might have a mentoring program, and hopefully, especially at the federal level, so we think about equal opportunity, that everybody would have access to the mentoring program. And not to say that, that always happens, but the idea would be that if they offer a mentoring program, that people would have equal access to it. That's my thought. I don't know if anybody else wants to try and address that. Okay.
We do have another question.
Okay.
How has CITC worked to address the challenges to social capital?
Okay. So we're just pulling back up our slides to go over our different challenges that we talked about. The disproportionate social ills, I think what we're doing, we're a fairly large organization, and sometimes it's easy to put up those silos within programs. And what we're doing is, within our different departments, is the directors are getting together and looking at how we can partner better to address some of these challenges that we have, and trying to figure out where we're overlapping in providing service, where we're maybe doing duplicate work.
I'll do this one. So when it comes to abuse and overuse of social capital, a lot of times that's a matter of awareness and empowering the participant with other options. I know a lot of times they'll say, well, I want to stay with my aunt, whoever is providing child care. And I just recently had a situation where an individual had to put her brother and sister out, who were their primary child care providers. And it was knowing that we have her support when it comes to child care. We even assisted with her finding different child care. But it's not only that, it's also with our general assistance program, we have encouraged them to, because the grant is so small, to be able to maybe purchase a room or rent a room from a relative. And that way both the relative and the participant can have savings in their income. But when it comes to the point where it gets abused and overused, then we help the individual find another place to stay. So it's little things like that to help them become more aware that there's other supports and resources out there for them, so they won't be abused or be overused as social capital.
Just a reminder to please put in your any questions into the lower left right corner of your screen to submit any questions to the presenters.
Here's another question for the panelists, for the panel. So what services may be most beneficial to families as they seek to combine their public and private safety nets to improve their well-being? I don't know if Natasha wants to address that.
You're asking a researcher a very practical question. I'm always hesitant to suggest anything if I haven't studied it. And so, I think it's difficult. I do think it's important in general to think about how these two sort of safety nets overlap. This isn't in particular necessarily to thinking about social capital per se, but some of my work has looked at people who are living with each other, sort of doubling up, and how that can be linked with what services they're sort of eligible for. So, for example, it can impact your SNAP eligibility because different people's incomes in the household will count towards sort of your total income. So it is important for us to think, and keep me employed to do more research in this area to think about how, use of safety nets, and I think the things that families really do need to do or rely on, and how that might interact with, other sort of public safety nets is important. I don't think it's, Tanf in particular doesn't face the same sort of issues, but certainly there's a lot of implications, thinking about the two together. But I don't know, maybe Andrew or Holly have something more insightful to say.
Could you repeat the question one more time?
What services may be most beneficial to families as they seek to combine their public and private safety nets to improve their well-being?
I think the Tribal Tanf program is a good example of a service that can help connect both of those. Here at CITC, when we first started the program, we had a much higher caseload. Now that we've been able to reduce it, we've been able to use some of that funding to reinvest into the program and enhance our services other than just, the traditional case management and cash assistance. So because we're able to reinvest into the program and expand what we do here and, try to build our program to, and also help build them their social capital, that's been a really great program for us to really serve the whole family versus just serving the parents. And so being able to take that, the funding that we saved and reinvest it to serve the whole family, I think is one way definitely to help families combine the public and private networks.
Thank you.
We have another question. Can you talk more about the Bridges Out of Poverty framework?
Yeah, so one of those benefits of the Bridges Out of Poverty, it kind of allows the individual to see poverty through the individual lens that they're actually going through. And one of the things I always tell my staff is, we have the three different socioeconomic levels, whether it be the wealthy class, the middle class, and the poor, the poverty class. And we kind of go over what it looks like in the wealthy class, and most of the people in my class are like, well, we're middle class, we don't want to be like that. But yet we try to make the poverty class like the middle class. And so helping those that are participants identify what are those middle class hidden rules is a huge impact for them and how to flow with that. And then identifying those resources that they need, and particularly since we're talking about social capital, the social resources that they have and how they can best utilize it. Then our next level is actually teaching those participants, not just at one-on-one with case managers, but getting them in those cohorts with the other peers and going over the different constructs so it can be eye-opening for them. And then with that information, as the case managers come back with them, they can both come up with better plans and to better utilize both all the 8 different resources that they have, including their social capital.
And I would have to say, to kind of add to that, is being raised probably more middle class. When I went through the Bridges Out of Poverty training, it really helped me to understand how we can provide services better to people who are low income. and maybe understand a little bit better from, because I always use my own personal experience when looking at, that's human nature to go off what your experience is in serving people, but, I didn't grow up in poverty, and so trying to understand why some decisions are made. When he was providing the training, it was a very aha moment for me because I kept saying, or I would hear staff say, why did they do that? Why would they do that? And talk about poor decisions made. But the training really helped us to understand, like he said, the lens through someone who's in poverty is definitely different than my lens. And understanding that so that we can create programs for them was really eye-opening.
Thank you. I'm glad someone in the audience asked that question because I've always been really fond of Ruby Payne's work. And so thank you guys for sharing that. Do we have any more questions?
Yes, we have another question for CITC. Have you found more social capital within family or in friends met through groups?
I didn't hear that last word.
I can reread it. It is,
okay.
Have you found more social capital within family or in friends met through groups?
I'm not sure why we can't hear that last couple of words where it says family or friends. What was the last thing?
Met through groups.
Well, so I think that a lot of it just really depends. We have a lot of families that migrate between here in Anchorage and the villages throughout Alaska. So it really depends on, if I'm understanding the question correctly, but I think it really depends also on the age range, because a lot of the folks that come into Anchorage that are older have a lot more networks and connections to people here locally than the younger crowd really relies more on friends than they do family. So some of our older crowds, they usually rely more on family. So I'm not sure if I'm answering this question correctly, but what we tend to have here is, I believe, friends, because we're connecting people across cultures, because our service population is so diverse and we serve all tribal members from any tribe that can provide that verification. So we're making connections that maybe wouldn't have been there before. So it's more of a friendship and across cultures, which is very unusual in some of our cultures because it's not uncommon for folks to stay within their own tribal kind of circle. And what we're doing is we're connecting them beyond those tribal circles and having them connect with people from other cultures, which are vastly different in Alaska. A lot of people connect with Alaska and Eskimo, but we have many, many cultures across our state. And so having them learn about other cultures and having them being able to share their cultures actually creates more connections with folks here. I hope I answered that, and I don't know if do you have anything to add to that?
No, I think you pretty much covered it. Just to emphasize the younger population, do seem to be more gravitating toward their friends and willing to make friends a little bit more organically than some of our older participants. But that's usually how it kind of spreads out. The older participants kind of gravitate with more family, and the younger ones, with younger crowd, with friends.
Thank you. We have another
question. Oh, go ahead. Sorry.
In regards to refugee or immigrant populations, would it be a reasonable assumption that social capital or social support have a positive correlation with reliance on one's native language, or does it not have a measurable effect on one's ability to learn English?
So I personally don't know about the literature that looks at sort of, what we kind of think of as immigrant populations that kind of stay within their own sort of language groups, and whether or not that's related to their social capital. I do know that sort of in general, at least in the data that I use, and now this has nothing to do with the language, and of course the problem is that each immigrant population is different. It depends on where you are, right? So in certain areas of the country, you may have sort of a higher concentration of the same immigrant population. But at least in terms of my data, what I see is that immigrant populations actually, so we know that they tend to have a stronger reliance kind of on extended networks, so extended family and friends, whereas sort of native populations or U.S.-born folks tend to have a lot more family that they can rely on. And what we see in the fragile families is that, on average, the immigrant populations actually have slightly lower levels of social support, in part because I think that they don't necessarily have family here to rely on all the time. In the same way that we might if you are here and you have sort of, your parents and your grandparents and so forth that are living in the U.S. But maybe you have different experiences sort of on the ground, Holly and Andrew.
We don't have as much experience with the refugee population. Most of our services are geared mostly to Alaska Native and American Indians. But, I would say within the Native community, it's a close-knit community, but it's not as close-knit as what we've seen in the refugee population. They have a tighter-knit community, and I noticed some of our folks that have limited English, their children are learning English and becoming interpreters for them, so they have less of a need to learn English. But we don't have as much experience in that area. So.
Okay. I had a question just for Natasha, just thinking about the slides on childcare, and I hope I understood this right. So participants or families who use relative care, it wasn't necessarily about the expenses, but it was more about preference. Have you had other people ask you to look deeper into that issue? And the reason why I'm asking is because there's a lot, there's a lot of conversation right now with Tanf participants and also other low-income families looking at barriers to returning to school, and then also looking at going into the workplace. And one of the something that's always cited is the expense around childcare. But I heard you say that it might not necessarily be, the cost might not have as much to do with selection but more so with people's preference. Is that what? Did I understand that right?
Yeah, you did. That's an assertion, or I did make that statement. So I want to say that, I haven't studied in particular whether or not, why people make child care decisions personally. Okay. I know that there's a big literature in this that suggests, right, that that certainly cost is a huge barrier for a lot of people, but that it's not limited just to low-income folks for whom that is true, right? I can speak from my own experience as not, also that it's just, they're very expensive. But also I think that the literature in this area does sort of suggest that when people make decisions about child care for many reasons, and obviously cost is a huge piece of it. So I don't want to say that it's not a very important predictor or reason that low-income families may choose to use kin care, but that there's no difference, it doesn't seem to be any sort of difference across different, at least in this sample, across the different kind of groups in terms of the use of kin childcare, which is suggestive of not just income at work here. There are other things too. So yeah, okay. I wouldn't say anything too causal about this by any means.
Right.
I think cost matters for sure.
Great. Okay, so do we have any more questions? Final questions?
No other questions have come in.
All right. Well, at this time, I just would like to thank everyone who participated in today's webinar. And I really would like to especially thank our expert presenters. Very, very informative. And then I want to remind folks to remember to provide your feedback on this webinar using the survey that will appear in a separate pop-up window when the webinar ends. Also, just as stated before, a transcript and audio recording of this webinar will be available shortly on the Peer TA Network website, which is at www.peerta.acf.hhs.gov. We would also like to hear from you about future webinar topics, so please send us your ideas by email to peerta, and that's one word, at icfi.com. So that's peerta at icfi.com. And also, we're really interested in expanding our network, and we love to reach a greater number of people by directing, and you can help us by directing your colleagues from your local and state networks and agencies to our website. And again, that's www.peerta, which is one word, at acf.hhs.gov. So we look forward to your participation on future webinars. So thank you, and everyone have a wonderful day. Thanks.